Well, good morning, ladies and gentlemen. Thank you for the invitation to be here in Shenzhen. It's a great privilege for me to be here with my very good friend, Dr. S.H. Lui and colleagues, and of course with Professor Prudence, who I know, and I've met Professor Yuan over the last couple of days. I'm going to talk a little bit differently, not about healthcare systems, but hopefully about some of the factors that are required from the leadership level to create sustainable systems. But before I do, I just want to also bring greetings from the Australasian College of Health Service Management, of which the Hong Kong College of Health Service Executives is a branch. We have one in New Zealand, and some in India, and many other people from around, particularly the South Pacific, including Thailand and in Southeast Asian countries. So I bring you greetings from the Australian. And if you're not a member of the Hong Kong College or similar, then hopefully by the end of my talk you might be. Many of you will be wondering how I got my name. So my grandfather was born in Guangzhou, in Canton. So that's why I'm Fong. I don't look very much like Fong, but that's my grandfather and my father. You can see in the when he was a child. That was my father. That was my father when he passed away about 4 or 5 years ago. And there are my brothers and siblings. So you can see that I don't bear much resemblance to with a Chinese background, but that's where the name comes from. So I love coming here because I do love Chinese food, as you can see. Anyway. Look, it comes as no surprise that healthcare today, as Professor Yuan was explaining us, we do face unprecedented challenges. Some are immediate, some are more long-term, but many are interrelated, and all of them are very complex. None of them are small, as they include the financial sustainability, as explained, quality, mission, patient safety, rapidly advancing technology, changing expectations of patients and consumers. Workforce shortages, of course, tops all of us. Talking to Dr. Lam from Hong Kong Psychiatry and Mental Health, psychiatrist shortage of healthcare workers, whether they be professional or support workers, is probably the world's #1 problem at the moment. But if there's one more challenge that is more important than even all of those things, I believe that it is the requirement for good leadership in our healthcare system. Now, we are all committed and working to develop excellent, sustainable healthcare systems. This is in all of our mission statements. We want to be excellent, we want to provide the very best and so on. But is there something that can make a difference if we actually create that? What is that? And if we can identify what that is and then amplify it, grow it, develop it, and export it, then maybe we will achieve the sustainable healthcare system. I believe that it is leadership that we need for our healthcare system to make it sustainable. We need to invest in our leaders and their development. So Bruce Keogh, the Chief Medical Officer of the NHS some years ago, made this statement. He said, the quality of the leadership and management is going to be the difference between excellence and mediocrity and success and failure in all organisations. But if that is my thesis, if that is my proposition to you, let me work backwards to lead you into that journey of what I believe will create sustainability. Firstly, we just heard about is it resources? Is it resources that we need? Money, innovation, technology, research, expertise. Is that going to make the difference to create a sustainable healthcare system? Well, of course, the healthcare system could have every dollar of every budget that a government has, and we will still not have enough. We know this. And we know that it's not just money that makes a difference in terms of the outcomes. If you read the Commonwealth report put out called Mirror Mirror, which identifies and shows the difference between the health outcomes of populations in the OECD countries, you will see that the USA spends the highest amount on its healthcare system, but does not have the best outcomes either at the patient level or at the hospital health system level. So it's not just about money. Is it the physical infrastructure? Is it the quality, the technical, beautiful hospitals that we all want to build, or the health clinics? Is it the people resources? Is it if we have more people, then we will have a sustainable healthcare system? Is it the research, expertise, the innovation, like this symposium is trying to challenge us to be? Is that going to make the difference? Or is it the policy settings that Dr. Ewan talked about before that will make the difference? Well, of course, the answer to that is a true answer to the question. The answer is, of course, all of those things are going to make a difference. But is there one or two missing pieces to what will make this a sustainable healthcare system? Is there something which will bring all the ingredients together? And of course, my answer is yes. It is leaders and leadership. Leaders who are capable and competent, who have the skills to enact and execute change. And if it's great and competent leaders, if we agree with my proposition, what does that look like? And how do we actually grow it and develop it? And this is where the topic of leadership development comes in. Now, the primary reason leadership today is so different is because yesterday is so different to today. We live, I should have added the other two pieces to the puzzle. We live in this, you've heard of this expression, the VUCA environment. We live in a world that is volatile, uncertain, complex and ambiguous. We live in a body environment which is brittle, anxious, non-linear, incomprehensible. You might have heard of this one, where we live in an environment that is rapid, unpredictable, paradoxical, and tangled up. And this last one, which is we live in an environment which is turbulent, uncertain, novel, and ambiguous. Leadership has no meaning without change. If the world were static, if it was static, management would have it humming along in a planned and ordered way. Leaders, however, seek the opportunity to change, for change means improvement and growth. In the ACHM, for example, we have a very simple motto: better leadership, healthier communities. And we underline this very simple proposition: better leadership, healthier communities, that's healthier patients, healthier families, healthier health systems, by emphasising that leadership is lifelong, learning is lifelong. Now, just also, we need some type of scaffold, if you like, to help us, a framework to understand leadership. And I'm not going to go in today to the leadership competency framework, but our college and the Hong Kong College follows this as well, as a competency framework which outlines the things that we require to be as leaders if we are going to make a difference in this world. And I'm not going to go through them there, but I can refer you to our website, acsm.org.au. I want to talk a little bit about, though, an excellent paper that was put out by McKinsey in 2019, where they described the 7 essential elements of a lifelong learning mindset. Organisations around the world, as I said, are experiencing this rapid change. And so we need leaders who have new skills to meet all of these challenges which I talked to you about. In fact, studies show that workers who maintain their ability to learn outpace other professionals, and the people who will thrive in the 21st century will be those who embrace lifelong learning and continually increase their knowledge, skills and competencies. But the burden does not all fall exclusively on companies, hospitals, health systems. It is also up to individuals to seize the opportunity. So 7 distinctive practices I found very useful, outlined by the McKinsey report. The first was to focus on growth. Learning starts and ends with us as individuals. Many studies have confirmed that it is not intelligence that creates expertise, but work and effort. The most successful leaders devote many hours to deliberate practice, tackling tasks beyond their current level of competence and comfort, observing those results and making changes. Indeed, the brain is like a muscle that gets stronger with the use and learning prompts neurons in the brain to make new connections. Now, people generally fall into two categories of leadership. One is a fixed mindset, where they believe that their learning potential is predetermined by their genetics, their socio-economic background, or their opportunities available to them. Or there's those with a growth mindset who focus on growth, who believe that their true potential is unknown because it's impossible to see what the future lies. And that's the type of mindset we need, that we are focused on growing our learning. The second is become a serial master. Now, traditionally, workers have stayed in one discipline in their career and supplemented their knowledge over the years on the job. You can see it like this. You stay, you find deep expertise because you've been into one job. But people are not doing that anymore. They are moving around in their jobs. And so you need to have, in a sense, not just that T-bar, but you need to have the M-bar, where people develop deep expertise in many other different areas over the lifetime of their career. Many researchers have also suggested that people, coming back to my original here, that you need to have an essential ingredient of a learner is to have stretch opportunities. So you need to make sure that you are taking on responsibilities to put you outside of what we call the comfort zone, where the tasks that you're not entirely comfortable with can be opportunities for you to learn. New challenges. Lifelong learners however, can avoid this pitfall by starting off and challenging themselves by stretching themselves. The fourth thing was to build a personal brand and network. Everyone has a personal brand that communicates values and provides a focus for their learning and development. When colleagues understand who a person is and what unique abilities, capabilities they bring to the table, that person is more likely to receive interesting new assignments or be considered for new positions. So we need to be continually learning in this space and putting ourselves out there. A personal brand is not static, it grows and evolves over your career. The fifth thing is to own your own development. Lifelong learning and employment no longer exists with the one organisation. So we need to maintain this ongoing motion going forward. Become successful. You see, how can I ensure myself take responsibility for our learning? And in the literature now, we're talking about this personalised learning cloud, where you can actually put together, whether it be micro-credentials, attending symposiums like this, being part of a college, reading journals, being part of a mentoring group, and so on, help you grow. The sixth thing is do what you love and discover your agaki. Most of you would have heard of this Japanese, there's the comfort zone I was talking about. Most of you would have heard of this concept that the Japanese have of igaki, where you do what you love, you do what the world needs in terms of the mission, you do what you can be paid for, and you do what you're good at. And at the central and at the intersection of this is your igaki. Igaki lives at the intersection of these questions. And of course, everyone in this room is going to have a different journey of those four different things that come together to provide that purpose, meaning, and passion. Bringing it all together is not easy, but it takes reflection on each of those things. And the last thing, if you go back to that diagram, was that to stay vital. The ability to stay vital as leaders will contribute significantly to your development. This means health and well-being is a priority. Exercise, nutrition, sleep, relaxation, mindfulness, yoga, developing good sustainable habits. Personal care and self-nurturing can be far-reaching and so important. So these are the 7 essential elements of lifelong learning. I want to just pause there and just remind us that I believe that leadership does build over time. I like the term capabilities versus competencies. For many, the idea of competency means that you find the bare minimum. If I reach the bare minimum, then I'm competent. I like the idea of capability, so that you have the capability to keep learning over your life journey. So capabilities over the life cycle is very, very necessary. What are the core, and what the other issue that I want to address today is how we do this leadership development. You've heard of the 70-30-10 concept or model of learning. This is the idea there where you want to develop your leadership. It's not just by going to do a master's program at Hong Kong Polytechnic or Hong Kong University or wherever. It needs more than that. You would agree with me. It needs much more than that. Such an important part of that. But probably only 10% of the learning opportunities and challenge is going to come from formal learning. 70% that is going to come from actually learning on the job. So we in the leadership development, colleges and professions need to provide and understand how we can organise that people can experiment by learning through this action learning experience. And of course, the other 20% is through personal interrelationship, networking, mentoring. How many of you in this room are mentoring the next generation of young people or younger leaders that are coming through? How many of you are actually being mentored by senior people that can actually contribute to your life? Now, I'm not going to go into this leadership study because we don't have time to do this today, but I do point forward to that. And this repeats what I was trying to say before. There's too many, we don't have enough time to go on. But I do want to just draw your attention again to this Harvard Business School publishing report, which talks about the challenges for leadership development today. You know, I've talked today very much about the complex universe that we live in. The other skill that is going to be required for future leaders of tomorrow is this tech savviness, the ability to actually understand that we just don't need to be digitally educated, we actually live in a digital world. And so you have to come to grips with that. That's going to change all of our lives. The importance of humanising leadership in this digital age. We all understood how in many respects during COVID we went backwards a little bit because we lost the contact, the human relations. But how important that skill is of being able to lead people, give feedback to people, communicate well with people, encourage people, stimulate people, discipline people where necessary. All of those skills are very important in the humanistic approach to leadership. And of course, we have to understand that we have to be leaders in a very hybrid world, where some people are working from home, some people are working in a different country, some different time zones, different professions, all need to be coming together and we need to be able to develop leaders in that environment. As I said, I'm not going to go into detail about that, but the slides will be available to you. I want to encourage each of us here to remember that this commitment to lifelong learning is just so vital. I love this illustration, this idea, this concept. It was put out by Ram Chan, an Indian author who is not academic, but he's a leadership motivator. And he talks about the 3 levels of leadership that we need as individuals in the world. You know about all the space travel and landing on the moon and Hillary, Edmund Hillary and so on. He talks about having leadership at 3 different altitudes. He calls it altitude leadership. At the 50,000 foot level, at the 50 foot level, and at the 5 foot level. These are the types of leaders that we need to develop. At the 50,000 foot level, at this level, I'll come back to that in a moment, at the 50,000 foot level, it's this maximum altitude where leaders are able to see the big picture, understand all the things that Professor Neale was talking about before, who can see how a system changes are required. So they envision possibilities to connect all those different parts of the system understanding at the 50,000 foot level. At the 50 foot level, this is more where you're closer to the ground. And at this altitude, thinking is more encompassing the short-term or the granular goals for your organisation. And you're here thinking about how you implement and how you execute. And of course, then at the 5 foot level, this is the level of ourselves, where we need to be profoundly aware of our own personality, our own capabilities or lack thereof, and how we interact with other people, and how we need to grow that out. Self-knowledge, self-understanding. If you do not understand who you are and how you act as a leader, you will not grow and be the leader that we need for a sustainable healthcare system. So I really like this idea. And of course, this other idea there is if you're not providing that leadership at those different three levels, you don't do it all the time. If you're not doing that, you get altitude sickness. So, if you need to be at the 50,000 foot level, be there. But if you're not there, you're avoiding what needs to be happening. So I quite enjoy that as just an explanation about what are we talking about when you say leadership, leadership, leadership. It's leadership at all these three different levels that we're talking about. And of course, if you go back to the framework, that also explains the opportunity. So you need to adjust your altitude as a leader. Sometimes it's there, sometimes it's there, sometimes it's there. At the college, as a final, as I spoke of, we have many different programs. The Hong Kong College is part of this. This is where we can provide certification, accreditation, the fellowship program, where it is the highest level of achievement. But we need more than these programs. We need to have this on a lifelong opportunity of learning. The certification is important as this is part of building your brand. You want a sustainable healthcare system with good leadership. You build your brand by doing these different opportunities that give you digital badges and so on. And of course, the fellowship we talked about before is available, and we have many from Hong Kong in particular going through that this year. I want to leave you just with three quotes that I've always found inspirational in terms of talking about leadership, providing the leadership for a sustainable healthcare system. The leader's job is to have the best idea. You don't have to be the smartest person, but you do have to have the ability to get all the ideas from everybody else in your team, your organisation, or your committee, or your board onto the table. That makes sense? That's our job, to facilitate. So the best ideas, you don't have to be the neuroscientist or the best policy developer. You need to be able to, you need to lead in this way. The other thing is management efficiency is climbing the ladder of success. Leadership determines whether the ladder is leading against the right wall or not. So make sure that you do understand that the leadership and management discussion definition. I like that to say. And of course, lastly, from John Dewey, we do not learn from experience, we learn from reflecting on experience. It's so important that we look at ourselves, reflect all the time on what we're doing and how we're doing it in an organisation. That's what will make it sustainable. That is my challenge to all of us to actually create a sustainable healthcare system. Thank you very much.